Chapter 39, Promoting Musculoskeletal Function by Mrs. Nakia Henderson, RN BSN. Lesson 39.2, Assisting the Immobilized Patient. Theory objectives include: describe how to perform a neurovascular assessment on an immobilized extremity, discuss the use of bandages and slings to immobilize a body part. Clinical practice objectives: teach a patient to properly care for a cast following discharge, correctly apply an elastic bandage to a stump after an amputation, transfer a patient using a mechanical lift, assist a patient with the use of each of the following: walker, crutches, cane, brace, prosthesis, and wheelchair. Assessing the immobilized patient. Assess for indicators of circulatory impairment. Look for signs of respiratory impairment. Determine which activities of daily living the immobilized patient can perform. Perform a neurovascular assessment for any patient with a cast or traction device. Assess for cultural beliefs and customs. Assess the pulleys and ropes for proper function and free movement. Assess any aids to ambulation for structural problems, fit, and safety. Assess patient's gait to determine stability. What areas of an assessment are important to include in your nursing documentation? What particular assessments are the focus of an immobilized body part? For question 1, besides the regular assessment, which is head-to-toe systems, you should include a more detailed assessment on the immobilized body part. For question 2, the answer is to include assessment on the skin, movement, sensation, pulses, capillary refill, and pain. Neurovascular assessment. Neurovascular assessment is performed every hour for the first 24 hours and after the cast dries every 4 to 8 hours. Check agency protocol for specific time schedule. Inspect skin, area distal to the injury, noting color, temperature, and compare with opposite extremity. Visualize movement and ensure there is no pain with movement. Inquire about feelings of numbness or tingling. Check sensation with a paper clip and compare bilaterally. Palpate pulses distal to injury and compare bilaterally. Check capillary refill bilaterally. Monitor pain, degree of pain, location, nature, and frequency. 39-11, assess the gait of the patient, learning to use a walker. Common nursing diagnoses: impaired physical mobility related to hemiparesis or hemiplegia, impaired physical mobility related to fractured extremity intraction or a cast, ineffective tissue perfusion related to decreased circulation in the lower extremities, impaired tissue integrity related to skin disruption, acute pain related to tissue or bone injury or muscle spasm, ineffective airway clearance related to inactivity and bed rest, risk for disuse syndrome, risk for peripheral neurovascular dysfunction related to fracture and cast application. Using bandages to support, apply pressure, or immobilize. Applying elasticized bandages, elevate and support limb while applying. Wrap from distal to proximal. Apply even pressure while wrapping. Overlap turns equally. Smooth out wrinkles. Secure the end with safety pin, tape, or clips supplied with bandage. Check neurovascular status. Remove and rewrap at least twice a day. A bandage change may cause discomfort for a patient. What are some interventions the nurse could implement to provide comfort? The answer: administer pain medication 30 minutes before the bandage change. Ask for another staff member to assist with supporting the limb if needed. Explain to the patient what you are doing and provide distraction during procedure. Wrapping techniques. Circular turn, used for proximal aspect of finger or wrist, used to anchor the bandage and to terminate the wrap. Spiral turn, used for upper arm or upper leg, used to bandage parts of the body that are uniform in circumference. Spiral reverse turn, used for lower leg or forearm, used to bandage body parts not uniform in circumference. Figure 8 turn, used for elbow, knee, ankle, or immobilize and hold fractured clavicle. Used to bandage and stabilize an elbow, knee, or ankle, or to immobilize a fractured clavicle in position. Figure 39-12A, applying an elastic bandage, circular turns. Figure 39-12B, applying an elastic bandage, spiral turns. Figure 39-12C, applying an elastic bandage, spiral reverse turns. Figure 39-12D, applying an elastic bandage, figure 8 turns. Bandages used to support, apply pressure, or immobilize continued. Recurrent turn, used to cover distal parts of the body. End of finger, skull, stump, left of amputation. Thumb spica, a variation of the figure 8 bandage used to support the thumb in neutral position following a sprain or other injury. Used for the thumb, hip, or shoulder. A sling, holds extremity in an elevated position to avoid edema of the hand, pain and discomfort, and fatigue. Wrist, elbow, and shoulder. Figure 39-12E, applying an elastic bandage, recurrent turn bandages. Figure 39-12F, applying an elastic bandage, thumb spica bandaging. Figure 39-13, a triangular bandage sling. Using a mechanical lift to transfer immobile patients. Can be used to move a patient from bed to chair or stretcher and back again. Hydraulic pump allows one nurse to lift patient. It takes 2 people to use the lift safely. Patient must never be left unattended in the lift. Also used to place patients into a tub or whirlpool bath for bathing or hydrotherapy. What types of patients would a mechanical lift be helpful in transferring? A new amputee, obese person who cannot stand, very weak person, person with cast on each leg, paraplegic or quadriplegic patient. Aids to mobilization, walkers, frequently the first mechanical aid used when training an individual to walk following a loss of function. Elbows should be bent at a 15 to 30-degree angle while standing upright. Crutches may follow the use of a walker or be the first aid to ambulation. Crutch pads should be 1/2 to 2 inches below the axilla in a standing position. Resting the body's weight on the axillary bar puts pressure on vital nerves and can occlude blood vessels in the axilla, causing damage. Canes. Most commonly used are the standard 1-point and the quad 4-point cane. Wheelchairs. Used for patients who are not able to ambulate either independently or with aids. Braces, splints, and prostheses for stabilization. Prostheses are used to replace missing body parts. Braces and splints are used to strengthen and support areas of the body affected by weakness or paralysis. What are priority teaching points regarding the assistive devices? The nurse must wear proper footwear to prevent slipping. Keep floors clear of clutter. Keep pathways well lit. Keep device within reach of patient. The devices should be adjusted to fit patient's height. Report problems to physicians or caregiver. Figure 39-15, regular cane, which is on the right, and quad cane, which is on the left. A regular cane provides support, whereas a quad cane provides support and stability because of its broad base. Aids to mobilization continued. Rehabilitation. Exercise prescription to improve muscle tone, joint flexibility, and/or cardiovascular fitness. Parameters for exercise determined by target heart rate during activity that is based on age and condition. Question number 1. When discharging a patient on crutches, it is imperative that he know there should be how much space between the top of the crutch and the axilla when his hands are gripping the crutches. Number 1, 4 inches. Number 2, 12 inches. Number 3, 2 finger breaths. Number 4, 4 finger breaths. Question number 2. Tim's patient needs a lift to help him get into hydrotherapy. When using a lift, all of the following are true except: number 1, one person can safely move a weak patient this way. Number 2, you should never leave the patient unattended. Number 3, you should protect the lift with a sheet or bath blanket. Number 4, if a lift is soiled, you should use a disinfectant solution before using it again. Questions, answers. The end.